The team, may we ensure that everyone comes into the room and we close the door. Thank you. Let's be seated, please. We are starting now. Your Excellency, Dr. Jean Cassé, the Executive Director of the Africa Series, Honorable Minister Sylvia Matsepo, in absentia, we are still waiting for her. Is around and will be joining us shortly. Professor Senait Fiseva, in absentia. Prof. Margaret Gapo, CPHI 2023 co-chair, Director of the Institute of Health Research at the University of Health and Alliance Science. Professor Roma Shilengi, in absentia, CPHI 2023 co-host, Director General, Zambia National Health Institute. Prof. Roma Shilengi is here. My sincere apologies. Thank you. Welcome to commence the PA who are present here.
Recording in progress.
I want you that this is a very powerful Africa-led platform where we are showcasing knowledge and also African policymakers, health advocates who are setting the health agenda on the African continent, as well as to map the way forward for health. Continuing to the press briefing, I would like to share with you some ground rules on the briefing. We will have, first of all, we will have briefing notes from the speakers seated on my right. And thereafter, we will give a platform to the members of the media to ask questions. Each member of the media is requested to only ask one question specifically for this, which is specifically covering the theme of the CPHIA. If there are any issues or agenda you would like to address, I will encourage you to meet me outside of the room after the press briefing. After the Q&A, I will also give a platform to the speakers to provide some ground information on the opportunities for CPHI and the way forward. Let me welcome His Excellency Dr. Jean Cassé, the CDC Director, will come and deliver his statement. Thank you. Your Excellency, you have the floor.
Good morning to all of you, and let me welcome my sister, Minister Sylvia Matsepo. My sister, this is your place. it was a perfect moment to start this conference by having our host, the Minister of Zambia, Her Excellency Sylvia Masebo. As I had to say, she's not only the Minister of Zambia, she's also the chairperson of the Africa CDC Governing Board. Today we are celebrating a wonderful moment where Africa is hosting the world. The world is coming to discuss with African leaders, with African researchers, with African advocates on how we can break the barriers. We have to say no one will be safe if everyone is not safe. It means Africa is contributing to the global health security. We cannot ignore that. We have to acknowledge bringing to the world and what Africa is giving to the world. And today we have 5,000 people physically attending the CPHIA. I was told there are 20,000 people following virtually the CPHIA. This is the second biggest public health event in the world after the WHO. And we have all global leaders here, but most important, we have our political leaders, our head of state, our prime ministers, and our ministers. We have around 35 ministers of health coming from all regions, and we are all hosted by Zambia. We thank the government of Zambia for. With this theme, breaking the barriers and repositioning Africa in the global health architecture, we position to position not only Africa, because this is the time for the world to hear from Africans. This is the time for the presence of African leaders. Also, this is the time for us to have Africans playing a key role in all of these organizations. We will think for the next we will be together.
Thank you and good morning. Good morning. Hi, table. Good morning. The room doesn't feel like it's a very special day. Good morning, good morning. Your Excellencies, members of media, all protocols observed. I'm thrilled to inform you that Zambia is proud to be hosting the 3rd International Conference on Public Health in Africa in Lusaka, Zambia. I'm also proud that the President of the Republic of Zambia, His Excellency, Mr. Hakainde Hichilema, for accepting to elevate the opening session of the conference to a state function. First in public health event history. This significant honor has set the bar even higher for other countries that will be hosting the CPHIA in the future. I also wish to inform you that the President of Zambia's commitment to the health strategic agenda is perfectly aligned with the Africa CDC mission's public health institutions agenda to detect and respond quickly, effectively to disease threats and outbreaks. On July the 16th of 2022, the President of the Republic of Zambia hosted a high-level side event at the Africa coordination meeting, resulting in adoption of the historic Lusaka call to action. This call to action aims to strengthen public health emergency operation centers is CPHIA theme of championing health initiatives on science, innovations, and breaking barriers on research, among others, to reposition Africa in the global health architecture. Esteemed members of the media, in support of our African health security agenda and the trust bestowed upon me by my Zambian president as health minister, I'm equally honored to serve as the second chairperson of the Africa CDC Governing Board and the first woman ever to hold this position. Thanks to DG and the ministers of health in Africa. Since my election in June of 2023, the Africa CDC Governance Board, under my leadership, supported by the brightest and committed Director General of Africa CDC, Dr. Jean Garcia, made significant progress on governance of Africa CDC. Some of the key achievements that we have made so far include approval and launch of the Africa CDC Strategic Plan 2023 to 2027, which outlines a clear roadmap to address the continent's health challenges, strengthen public health systems, and ensure a coordinated response to emerging threats. Secondly, we have done the formation and inauguration of the new Africa CDC Advisory and Technical Council. We've also inaugurated the new governing board of the Africa CDC, which saw me as the new chairperson. We've also approved the new Africa CDC structure that will significantly enhance governance issues whilst promoting efficiency, effectiveness, and responsiveness. There is a strategic reorientation of the Saving Lives and Livelihoods Initiative, which we're partnering with the MasterCard Foundation, focusing on vaccinating high-risk populations, integrating COVID-19 response into routine immunization, and proactive preparation for potential future pandemics on the continent. We've also strengthened partnerships with Gavi through the signing of the Memorandum of Understanding to support immunization agenda in Africa, along with advocacy efforts for strengthening local manufacturing on the continent. The issue of local manufacturing is a big agenda for Africa CDC. Leadership in pandemic preparedness, prevention, and response in Africa by strengthening partnerships with WHO and partners, launching the Joint Action Plan with WHO Afro and EMRO, advocating for local manufacturing of health commodities, and supporting the decisions of heads of state per the new statute, which was approved in 2022 for Africa CDC to declare public health emergencies of continental concern. Also to support African member states in negotiating the pandemic treaty and the new international health regulations, including articulating a common African position on the same as deliberated by the Specialized Technical Committee on Health. Lastly, though not the least, launching of the new vision for community health workers in Africa through support for community health delivery partnerships. These achievements would not have been possible without the exceptional leadership of the Africa CDC Director General, Dr. Jean Garcia, and indeed the Ministers of Health and the Governing Board. I want to commend him for his outstanding leadership and clear vision in transforming the Africa CDC into a world-class institution that champions Africa's health security. I therefore implore the media to help us to spread the word about Africa's commitment to global health as a key player. Let us join hands and support this important cause. I thank you.
Thank you, Honorable Minister. I now call upon Professor Margaret Giapong, CPHIA 2023 co-chair and the director of the Institute of Health Research at the University of Health and Allied Sciences. Prof. Margaret, you have the floor.
Thank you very much. Honorable Minister, DG Africa CDC, I'm supposed to be highlighting some issues on groundbreaking innovations and ingenuity of African scientists, researchers, and entrepreneurs in collectively driving forward a healthier, more prosperous future for all. Distinguished ladies and gentlemen, members of the media, the fact that two heavyweight ladies are sitting here by our honorable gentleman is even groundbreaking enough. Africa is witnessing an unprecedented leap in health technology innovations. From mobile health applications that provide remote consultations and health information to telemedicine platforms connecting patients with specialized care, technology is bridging the gaps in healthcare access and delivery. The digital disease surveillance, which was piloted by Africa CDC in 6 countries, is developing digital surveillance indicators and online disease dashboards based on social media and search engines to inform infectious disease surveillance on the continent. Strengthen real-time surveillance of infectious diseases, guide interventions, and build capacity in big data approaches for outbreak prediction, analysis, and prevention. And even without these digital approaches, look at what we did in COVID-19. Our surveillance systems kicked in and we were in the remotest places. The success of these groundbreaking innovations rely on robust collaborations between governments, private sector entities, and civil society organizations. Public-private partnerships are fostering knowledge exchange, resource mobilization, and technology transfer, amplifying the impact of innovation in public health. African scientists and researchers are leading the charge in developing groundbreaking vaccines tailored to address regional disease burdens, including malaria, tuberculosis, and HIV and AIDS. Groundbreaking initiatives with the RTSS malaria vaccine demonstrates the significant contribution of African scientists and researchers in collaboration with international partners and organizations to address regional disease burdens. These efforts reflect the commitment of African governments, international organizations, and partners to improve public health outcomes and protect communities from vaccine-preventable diseases. In South Africa, Afrigen Lab, home to WHO's healthcare-focused technology transfer hub, is building the first African-owned mRNA COVID-19 vaccine in partnership with the Belgian group, Universalis, which could provide a new blueprint for healthcare innovation and global access to biologic drugs and vaccines. Kenya, with support from Path Technology to bring innovation, a local design and consulting firm, has developed a digital community surveillance platform that will assist community health workers and disease surveillance officers to detect and report unusual health risks and diseases at the grassroots level in a timely manner. This will enhance the availability of data for better disease prevention and response. To maximize the impact of these innovations, there must be concerted efforts to scale up successful interventions across the continent. Sharing best practices Replicating successful models and fostering collaboration are key to ensuring widespread access to these life-saving innovations. You'll be hearing a lot more about these innovations in the various sessions, and I encourage all of you to attend. Thank you very much.
Thank you to my panelists. I now open the floor for a Q&A questions. Each member of the media is only allowed one question. We have about 10 to 15 minutes for the Q&A, and let's focus on the subject at hand. The floor is open now. Thank you. Yes, the lady.
OK. Je vais parler en français, excusez-moi. Je suis Janine Forcam, je suis journaliste, je viens du Cameroun et je voulais poser ma question au directeur exécutif. Le thème de la présente édition de la conférence sur la santé publique est assez évocateur. Qu'est-ce qu'on veut briser? Quelles sont les barrières qu'on veut briser? Et on parle de repositionner l'Afrique par rapport à quoi? L'Afrique avec quelle position et quelle est la position qu'elle veut prendre maintenant? Voilà mes questions.
Thank you so much. I will take 3 questions at a time. Let me give the mic to my panel on the left, on the right, to respond to the question. Thank you.
Est-ce que je dois répondre en français ou en anglais? You want me to answer to in English or in French? You ask your question in French? Okay, because we have people following you in French. Okay, and let me take advantage of being bilingual to answer in French. On a un certain nombre de barrières dont on parle, puisque nous avons appris non seulement de COVID, mais de Ebola. J'étais en train de dire à 15 ministres de la Santé qui se sont réunis 3 jours durant pour ce qu'on appelle le Ministerial Executive Leadership Programme. Nous avions des milliers de morts d'Ebola. Mais le monde a découvert qu'il y avait un médicament pour guérir Ebola, un médecin d'un pays a attrapé Ebola, a thérapie, et après, on s'est rendu compte qu'il y avait des médicaments. Avec COVID, nous nous sommes rendus compte que l'Afrique a été... On n'avait pas accès au vaccin, on n'avait pas accès même aux gants, aux masques. Quand nous disons que nous devons couper les barrières, ça signifie que nous voulons aujourd'hui qu'il y ait ce qu'on appelle l'équité. Nous voulons que les populations africaines puissent avoir accès à tous les soins et à toutes les commodités comme les autres populations. Nous voulons aussi que la voix de l'Afrique soit écoutée. Nous ne voulons pas continuer à subir alors que l'Afrique a aussi à donner. Voilà pourquoi nous disons c'est le moment de repositionner l'Afrique. Repositionner l'Afrique, les chefs d'État le font dans différents domaines pour parler de ce que nous appelons l'architecture financière au monde, comment changer cela. Et nous, Africa CDC, comme étant la plateforme continentale pour la santé, nous disons nous devons changer l'architecture globale dans le domaine de la santé publique pour qu'on puisse commencer à considérer la voix de l'Afrique et les priorités de l'Afrique. Voilà en résumé ce que ces thèmes cachent et ce que nous allons discuter les 5 prochains jours.
Thank you, Your Excellency. Yes, the gentleman on the, yes, please. You have the floor.
Thank you very much. My name is Ridwan Karim Dini Osman. I'm a journalist from Ghana. My question has to do with, I know the Africa CDC thrives on data gathering, and in conducting your event-based surveillance, you fall on social media, and largely the internet. But we also know that in some parts of Africa, there are crisis situations. So you look at the Sahel where the military takeover is spreading. I would want to find out, particularly the public order, the new public order, how does that address, effective healthcare in crisis situations in Africa? Thank you.
I will take 2 more questions. The lady at the front in the black suit. Thank you.
Good morning, Kerry Cullinan from Health Policy Watch, Geneva and Cape Town. There's been a lot of skepticism about whether Africa is going to be able to achieve manufacturing vaccines 60% by 2040. I just wondered whether Dr. Casilla could outline some of the plans to achieve that. Thank you.
Thank you. Yes, the gentleman just right here in the front. You have the floor.
My question is directed to, I think it's Dr. Margaret. I don't know if I got the name correct. You spoke of well, my name is Michael Gwarisa. I'm a journalist from Health Times in Zimbabwe. You spoke of some of the initiatives that Africa CDC and Africa is doing to actually, link some of the health initiatives on the continent. But I just want to find out, with the surge or the rise of climate change related health issues, what is Africa CDC doing to actually try and prepare, for such emergencies that are actually arising? Like at the moment, we've got cholera that is ravaging the southern African part of the continent. I just want to find out, what is the Africa CDC doing to address that? Thank you.
Thank you.
Thank you. Let me go quickly. The first question, it was related to event-based surveillance, mostly in countries where we see some security issues, and what Africa CDC is doing. Let me tell you that Africa CDC is leading the agenda in 55 countries in Africa. We are not saying 50, we are not saying 40. 55 countries in Africa. We are talking about 1.4 billion people. It means for me as Director General, each African is important. And when there is an outbreak somewhere, when there is a public health threat somewhere, we need to intervene. And we have the new public health order. That is the blueprint. That is the long-term vision of Africa that head of state they wanted Africa CDC to implement. And we aim this new public health order by using what we call now the 5 C's. I think I met young people talking about 5 C's, and now it's become so popular. While we are implementing that, we need to have a strong component on what we call global health diplomacy. Even if you are fighting politically, even if you are fighting military, but when there is an outbreak will cross the border without your permission. This is why Africa CDC has a strong global health diplomacy department to facilitate this dialogue between countries, between communities, and to ensure that all of them have access to support, to commodities when they need it. We are there for all African countries, and we have this powerful convening power to put everyone together, all countries, all ministers. And this one, we are using it in Sahel. We know that Sahel is affected by dengue. We have 4,000 deaths. Yesterday, I was talking with the minister of Turkey, and I was talking with some ministers who attended the Ministerial Executive Leadership Program on how we can work together. It means for us, doesn't matter when we need to respond to the outbreak. We are supporting Western African countries to respond to dengue, as we are supporting other regions to respond to other outbreaks. Regarding the local manufacturing, please, let me emphasize something I have to say every day. Local manufacturing is the second independence of Africa. I repeat it, local manufacturing is the second independence of Africa. Our countries got independence in 1960. But we saw with COVID that we are not independent. We saw with COVID that all other continents can lock their door and we are left behind. We saw with COVID that African people could never, if they don't get what others they were calling appropriate vaccine. Who can accept that? Then we said, our head of state decided to create a program called Partnerships for African Vaccine Manufacturing, PAVM. The objective of this program is to manufacture at least 60% of vaccines that we need to use in Africa. When people, they say they don't believe on that, I say, as Director General, I believe on that. If I don't believe on that, I will not continue. Because I continue, it means I believe on that. What are we doing? First, we are working with our member state. We have a clear mapping of countries where we can manufacture a vaccine. We organize the meeting with manufacturers, ministers, partners, and the regulatory body together, how we can accelerate this agenda. I can do agenda on. Second, we started to work with our partners. Let me acknowledge the youth support from Gavi. Africa CDC managed to partner with Gavi and to have $1 billion approved by the policy committee of Gavi that will be tabled to the board in this Ghana. And I will attend this board meeting. That 1 billion is for African manufacturers. It will help African manufacturers to invest and to third one is to create the African market. We are working on what we call the pool procurement mechanism that will help us to use African products. And this is what President Ishelema was telling me last time. We need to apply the positive discrimination. It means let us first use African product in Africa. The last question very quickly, I think it was for my sister, Professor Margaret, but if she wants to hand over to us, we can support.
Thank you very much. You are talking about climate change. And then you said, what is Africa CDC doing about it? So I told him he's Africa CDC, but we are all Africans, African research institutions. Climate change, natural disasters, things that we can normally not do anything about, they happen. But talking from the perspective of a researcher and looking at what we are doing on the African continent, like my DG said, we are all putting our hands to the plow to make sure that things that we need to do are done and are done right. Maybe I'll leave it to you.
On climate change, do you know that there is a study from African Development Bank saying that every year we are losing between 5 to 15% of our GDP due to climate change? Do you know that we have 18 countries today affected by cholera as the effect of climate change to the health sector, with 4,000 deaths? Do you know that dengue in West Africa is also the effect of climate change? You saw the flooding in Libya. We can continue to give examples. It means climate change is affecting us. And this is why Africa CDC decided to implement what we call One Health approach to address the issue of climate change, animal health, and human. And that one, the Minister of Zambia took the lead to implement One Health in Zambia as a guidance from Africa CDC, WHO, and all other partners.
Thank you. I think the question on climate change is a very important issue, and you will take note that next week there is an international conference in Dubai. That's the COP conference. And for the first time, the connection of environment to health has been articulated. And for the first time, as ministers of health, we've been invited so that we can go and do justice to this issue, just to emphasize the connection between the environment and health. And as DG has ably said it, we in Zambia have moved quite far in the implementation of the One Health policy, so that we take into account the effects of climate change on health. Currently, maybe I've not told you, right now Zambia is battling with anthrax, which started in animal and now it has moved to human. Thank you.
Thank you. I will take the last 3 questions, and please be brief and direct your questions to a specific speaker. The lady in the green scarf, and I will take also another gentleman right at the back, and I'm working with gender balance, and the gentleman also on the this side of the wing. Yes, thank you. You have the floor. Please be brief.
OK. Bonjour, je vais poser ma question en français. Je suis Nabila Bekkas, journaliste du groupe Le Matin, un groupe marocain qui place la promotion de l'Afrique comme une des priorités. La thématique que vous avez choisie est importante, la promotion de la santé en Afrique et comment repositionner l'Afrique. Vous avez parlé justement de partenariat. Pour moi, qui dit santé dit aussi santé mentale. Donc, je voudrais savoir quel est l'état d'avancement de cette thématique dans le continent africain et pour vous, quelles sont les actions qui doivent être mises en place. Merci beaucoup.
Yes, the next one, please. The question, and you can your questions after.
Thank you very much. My name is Tesfai Balayeng. I'm from USCDC. My question is just personal question. Disclaimer, it doesn't reflect the agency policy of USCDC. My question is, in the last comment, in the environmental health and the climate change issue, is there a commitment at high level in Africa CDC to establish the environmental health and the climate change unit, department, or division? As you know, environmental is a very big issue: food, water, air, indoor quality, outdoor quality, poisoning, toxic investigation, and etc. I think it requires to address all this issue. So is there any commitment in the structure per se in Africa CDC to establish the environmental health and the climate change unit or department? Thank you.
The gentleman right here in the front.
Thank you. My name is Kemo Cham. I am from Freetown, Sierra Leone. At the center of a lot of the innovations you mentioned, Professor Jampong, is vaccine production. And we know one of the major problems we faced from COVID, from Ebola, I come from Sierra Leone, we faced Ebola, is vaccine acceptance. I would like to know, Africa CDC generally, and also you as an expert, if we have data to show that we have made some progress in having the people accept vaccine. And which programs do we have that are targeting this among all these innovations you pointed out?
Thank you. Let me give the floor to the DG to respond first, and then the panels can add in.
Quickly, puisque c'est en français, le matin, vous voulez écrire sur ça. Oui, Africa CDC a un grand département sur la santé mentale. Nous travaillons on a créé une plateforme continentale pour appuyer nos pays à répondre à cette question. Et avec COVID, on a vu qu'il y a eu même beaucoup plus de cas de santé mentale à cause de l'isolation et autres. Et donc, effectivement, nous sommes en train de travailler sur ça et on va vous donner beaucoup plus de précisions sur tous ces programmes-là. Nous voulons remercier tous nos partenaires, Wellcome Trust, Mastercard Foundation et WHO, avec qui nous travaillons ensemble pour ces programmes. Concernant, about your question, if we can have a department on unit or unit on environmental and climate change. Yes, we have a strong department. Even to show you that what I'm telling you is the truth, there is a lady called Yewan, the Dr. Yewan, who was leading that. It means we know what we are doing, and this one is a major priority for us. Let me now hand over to my sister for vaccine acceptance.
Thank you very much. I think we all know that bad news spreads quickly. So as soon as there's a little video clip about somebody saying the vaccines are going to make you impotent and you are not going to have children in Africa, it is an issue. Having children, being sterile, being a man is important to us. But the good thing is that we had our African leaders stand up and come out to say that, look, over the years, we've had children immunized from various conditions. In Ghana, I don't remember the last time we saw a case of measles due to vaccinations, and coming in quickly to be able to stem all these misconceptions about vaccines went a long way to be able to get people to accept some of these vaccinations. Just before COVID, we had the RTSS vaccine introduced in Ghana. And initially, there were some hesitations. But thanks to our public health system, community engagement, a lot of talk at the community level, the vaccine acceptance rate was really high. I don't have the figures in front of me, but I was part of the team that did the evaluation of the introduction of this. And we saw mothers rush to accept it. They believe in the public health system. They said they would not introduce something that will harm our children, and so would go for it. Right on the heel of that came COVID-19. And even the bashing along with that was more than you could think with the malaria vaccine. But today, at least in Ghana, we are seeing a lot more people in the region where I was from. They had the lowest coverage, close to about 20%. Today, it's moving up to about 60% acceptance rate. So I think if we nip it in the bud early and we engage the community leaders and community members, I'm sure we'll make a lot of progress with issues about vaccine hesitation. Thank you.
Thank you. I just want to speak about what's happening back home here in Zambia, that in terms of acceptance of the vaccination drive especially for our children, on average, we are over 75 to 80%. And I would think that is a very good rate. But suffice to say that we continue to work with the traditional leadership and the church to support government in ensuring that our communities acceptance can even go to 100%. But it is an issue. And I just want to say to the media, I think the media are the biggest tool that we should use to ensure that we are supported in this drive to get our people and especially the children vaccinated. It is social media that has actually worsened the situation. And I'm glad that this question has come when we are engaging not just the local media in Zambia, but international media. And I would like to use this opportunity really to appeal to the media to join hands with Africa CDC and African governments and the continent to really send the right vibes out there, because we know, all of us, even for me, just as a mother, that vaccination does help, and that my child was able to not to die at the age of 5 because of the vaccinations, and that we are alive today because we got vaccinated during the COVID time. A number of people died here in Zambia because of lack of vaccination. And I think that is the issue that Africa CDC is addressing, that we learned our lessons as Africans after the COVID-19, that we have to prepare ourselves. And that's why the agenda on local manufacturing is very, very dear to Africa CDC and even to Zambia as a nation. My president has made it very clear that it is one of his agenda that we must work towards having a sustainable production of drugs and not be dependent, because we learned our lessons during the COVID pandemic. Thank you.
Thank you so much for those inspiring responses. We are coming to the end of the press conference, and I'm going to give the platform to the panel to give us their final remarks on the importance of CPHIA and the theme on breaking barriers, and how Africa will reposition itself in global health, as well as align itself on the public health new agenda in ensuring that we strengthen Africa global health security.
First of all, just to thank the media for this briefing, and also to thank all the delegates that have already come into the country, and also to wish that this event must really help Africa to move the public health agenda a step further. But also, most importantly, to say that this is your event. It is our event as Africans, and it is an important event because we are taking the agenda of health as Africans. And we want to show that we are concerned about the health of our continent. And for me, as Minister of Health, I just want to welcome everybody to Lusaka, Zambia, and of course to thank Africa CDC and the African Union for having chosen Zambia to host this very important conference. Thank you, and God bless you all.
Thank you very much. A couple of years ago, you wouldn't have heard of a huge public health conference like this led by Africans, with over 80% of the presentations by Africans and Africans chairing this conference. And for me, that is a great innovation. We are poised to be able to make sure that Africa moves forward. We are poised to make sure that we take our issues into our own hands and deal with it with our partners. But we are taking the lead, we are being bold, and we know that we'll be able to reach the last mile. I welcome all of you once again to CPHIA 2023, and I wish us all a successful conference. Thank you.
Minister, and my sister Margaret, Pastor Margaret. I thank all of you and I thank members of the media. CPHIA is the platform where we have more than 120 side events in addition to the formal program. It's a platform where we have more than 5,000 people coming, exchanging, discussing about their experiences. It's also opportunity for more than 20,000 people to interact with us virtually. But CPHIA is also opportunity for the youth. We have 500 young people who made for 2 days on the margins of the CPHIA. And all of us will be aware of their deliberations. More than that, CPHIA is also the Ministerial Executive Leadership Program. We had around 15 ministers coming from all regions of Africa who met for 3 days, and Minister Sylvia Masebo was one of them, under the support of former ministers and respected people like Professor Awakol said, like Michel Sidibe and others. This is CPHIA. CPHIA is a combination of all of these opportunities to discuss, to talk, and especially this year, to celebrate our heroes. You will see today we'll celebrate one of them. It's also opportunity for us to talk about research and development, how we are pushing science in Africa. We believe with this wonderful moment that we'll have today, we'll push the agenda of the new public health order in Africa. And we know that at the end of this CPHIA, we'll say we managed it with our strategic thought to reposition Africa in the global health architecture. Welcome to CPHIA 2023.
Thank you so much to our panel, and thank you to our audience. You have been a great audience, and it was a pleasure hosting you. My name is Ndahafa Nakwafila. I'm the AG Head of Communication and Public Information at the Africa CDC. After we will allow the panelists to leave the room, and we will make an announcement to the audience where you can get material, and I will also like to give this platform to the Communications Secretariat of the CPHIA to come and give you some information in relation to this press briefing. Thank you all, and I wish you a great stay and great afternoon and day ahead. Thank you.
Thank you very much, the DJ, the Minister, and Prof. Margaret. As the DJ,